Can we talk for a second about ethics in plastic surgery? Because we were having an interesting discussion, my friend group and I, about our colleagues that do things way outside of normal. So I completely recognize that most of what I do is elective surgery, and we're making desired changes to people's bodies, whether it's cosmetic or reconstructive. And there's not a right or wrong with what people want with their bodies. Some people want smaller noses, larger lips, larger breasts, smaller breasts. You know, there's a lot of personal opinion and aesthetics that goes into these choices. But for the most part, everything is within the norm of what you see in real life humans naturally. But what about when it gets weird? What about when people are doing these things that, like these little upturned noses, gigantic, and I'm talking gigantic BBLs, gigantic implants, and things that really don't exist in nature? You do not see real life people that naturally look that way. And certainly the patients are signing on for this and asking for it, but why are we doing it? I mean, I feel really not great about it. Society already has really essentially unreachable beauty standards for women in particular. The bodies, they do happen in nature that we're all striving to have, are rare, right? Like we're trying to find something that's rare and difficult to achieve. But it takes it to another icky level when it's something that is not only rare but doesn't exist. Like if the beauty standard evolves to something that is impossible to have without surgery, that's awful. It's already awful enough that so many of us don't feel good about our bodies. And I get it, I'm a plastic surgeon, but I still can think about these things because I'm also a woman who is subject to society's beauty standards, and I have a little girl. And I don't know what the solution is. I don't know who would step in and stop these people. I have seen patients that did very, very extreme things and were very regretful later. I'm sure some of them are not, but I would imagine a lot of them are. And often the damage that's done by these types of procedures is extremely difficult to fix. And the surgeons that do this, when I see, people questioning them on their social media pages, will often say things like, it's not about them, they're helping her achieve her dreams, like they're some kind of hero, but I think they're actually the villain.